now we'll go on to the next question. I have a dark stain on my teeth. What do not to go away with cleaning, and what could be the reason, and what has to be done to that, and how can we treat that?
Yes. Now, if the stain is on the surface of your tooth and it's been there since you were a child, say you were 7, 8 years old, then these are permanent stains. These are what I call intrinsic stains. If it's very small, localized to just one tooth, the treatment is simple. Sometimes we just drill away the stain because it's on the surface. So when I talk about the surface layer, let's say it's within the first 1.5 millimeters of the tooth structure, you can just drill away the stain, use the composite of the exact shade as your tooth and do a filling, problem solved. However, most of the times, these stains are not that simple. If they are further embedded, if they are say 2-3 millimeters below the surface of your tooth, you can't do a filling. Then you have to do what are known as veneers. Veneers are nothing but, I'm sorry, I'm going to use this example, but I feel people understand it better. In your house, you have wardrobes built out of wood. Now the wood looks pale, dry, very uninteresting. Then you want to make it bright. So you use thin sheets of laminate, which are then stuck onto that wood.
Yes.
The way they stick it, they use a glue. Some people use Fevicol, some people use a different kind of bonded glue. Believe me, it's the exact same technology that we have adopted. However, because it's a tooth and it's not wood, the material we use is different. We use porcelain or ceramic. We use, there are times when we use different forms of zirconia in it, and thin sheets of ceramic are created using CAD-CAM designing. When I say CAD-CAM, it means computer-aided design, computer-aided machine. So the whole thing is designed by a machine into which the information is fed. So the accuracy with which it can trim or bring out a section. These veneers are less than a millimeter thick, but they can extend the entire surface of the tooth. They can extend a small surface of your tooth. We can cover stains. If there is a chipped off or a broken edge of your tooth, that can be corrected with it. If your tooth is marginally smaller or your tooth is marginally bigger, both of those changes can be made using a veneer. If you have mild crowding, which means your upper front teeth overlap each other a little, or your lower front teeth have a little bit of crowding. When I say little bit, we're talking in millimeters, remember. If there is a single tooth that is a little rotated and you kind of don't like how it looks, or most commonly when there's a gap in the center between two teeth. I know tradition says that it brings a lot of good luck, there are a lot of other beliefs, but if you are interested in closing it, veneers is the option for you. What is the good thing about veneers, Dr. Deepak? You agree? It's quick, it's simple, it's permanent, which means the day we fix it, whatever color your veneer is, 20 years later, it's going to retain the same color, the same texture, and the same finish. So it's not going to take up food color. It's not going to take up your coffee tea color. It shouldn't get damaged unless you do the unthinkable. So if you're going to try to open the cork of a beer bottle with my veneer, it's not going to be able to hold. So you need to be kind to it. And Dr. Deepak, like I tell all my patients, please frame the bill that you paid me when you got your veneers done. And every time you feel like doing something like this, look at the bill and you'll never do it.